everyone, and welcome to the Bronki Boosters podcast. It's a series where we invite healthcare specialists to come and talk to us about asthma. We'll discuss topics such as what causes an asthma attack, how to manage it, myths and facts about asthma, and many more. Asthma is an underdiagnosed and undertreated public health problem. Learn how to manage your or your children's asthma. On today's show, we've got Dr. Tshegofatso. Hi doctor, we're talking about asthma and the importance of making sure that when it comes to being at home with our children, we're constantly monitoring them. Talk to us about that importance of that, making sure that we're constantly monitoring our kids as far as asthma goes.
Thank you, Ryan. That's a very important question, and I'm really passionate about that.
Yes.
It's really important to monitor asthma when we have a child that's asthmatic.
Yeah.
I always say it's just the same as having a child who's diabetic and monitoring the glucose literally every day. So there are different ways of monitoring, and most importantly, there's what we call an asthma diary.
All right.
So you're able to write down what inhalers your child is taking, such as controllers and relievers.
Okay.
Right? And every day, your child will just take in the morning and in the evening when they take their asthma inhaler.
Yeah.
And they're also able to just record every day if they're having any symptoms, such as cough, difficulty in breathing, shortness of breath, or even wheezing, right? And that allows you as a mom or dad to be able to pick up when your child's symptoms are actually worsening. Okay, on the asthma diary, one is always also able to just write down what we call a peak flow meter.
Okay.
So I'll speak a little bit more about it.
Okay.
But there are also very friendly questionnaires.
Okay.
That vary depending on your child's age.
Right.
So for children between 4 to 11 years,
yes,
they actually have like faces.
Oh, nice. Very interactive. So you can go, how are you feeling today?
How are you feeling today?
Nice.
And it all gets scored as a total of 25.
Okay.
And I always say to the moms and the dads, just tick on where the parent is supposed to tick first.
Sure.
Because sometimes we look at our children's answers and then we lie. We let the answers influence our answers.
Yes.
So you tick as a parent, and then you allow your child to then feel, because children hardly ever lie. They always tell the truth. Exactly. Yeah. Any score that's below 19, then you know 19 out of 25, that now you're in trouble.
Okay.
And anything that's 15 or less, you know that the asthma is poorly controlled. So you're able to pick up, you're able to be in control, and you're able to tell that the asthma symptoms are getting out of control.
Because that was going to be my next question, is that if you don't monitor them at home, what are those symptomatic telltale signs that you're not controlling it enough at home?
Yeah, so your child will be telling you that they are short of breath or coughing or wheezing with physical activity or sports, while they're playing soccer or just playing outside with their friends. And secondly, you will not have a good night's sleep. They'll wake you up with the symptoms. And then thirdly, they might even just report the symptoms, almost frequently, more than 2 days in a week, and so on. And sometimes you might just see them, their school being affected, so being absent from school because of the symptoms. Yeah.
You mentioned something very interesting, a peak flow meter.
Yes.
Tell us a little bit more about the peak flow meter, and of course the benefits of having a peak flow meter.
Yeah, that's a must-have for any child or any patient that's asthmatic. It's a cute little small device that you can throw into your handbag or throw into a school bag. And it's usually used in children that are 6 years or older, but I always say, 3-year-old, 4-year-olds, just get them into the routine of blowing into that cute device. So what it does, it measures the flow of air when a child breathes out as fast as possible after breathing in, right? And it gives you a certain reading. So it's almost like your BMI, where a certain reading is normal or not normal, right? So it's based on age, height, and gender.
Yes.
And it sounds quite complicated. Your doctor will tell you this is what you're predicted.
Yes.
But the best way to know what you're predicted is when your child is well.
Yes.
You do it in the morning, same time. You do it in the evening, same time. For 2 weeks, and you're able to know what your child's best predicted is.
Absolutely.
So that's 100% when your child's lungs, and that's the reading that you would sort of use it as your landmark, right? Yes. And with the peak flow, like I said in the asthma diary, just let your child get into the routine. When they take their symptoms and how often they're taking their inhalers in the morning and the evening, let them just blow. It's quite fun.
Yeah.
Like a whistle.
My child, I've got a 5-year-old, did it last night into the peak flow. We
Fantastic.
And it's amazing to monitor, because as a parent you don't realize that your child actually could be coming down with maybe a precursor to an asthma attack. That on the peak flow meter you can pick up changes in your child's breathing patterns by monitoring it on a regular basis. So we could pick up before she even got any kind of a chest infection. It was coming because we could pick it up on the peak flow meter, which is very interesting.
Yes, it is very interesting, because it allows you to be, like I said, in control. So 100%. You're able to tell that you're getting into trouble before the symptoms come. Right? So, if you must have an action plan, what we call an asthma action plan with your medical doctor.
Yes.
And where it's a red flag or orange or green. So when you have that predicted number that I told you, that's 100%, anything that's 80%, you're on the green, you're great. When it's anything between 50 to 80%, then it's orange, you're in trouble. Yes. Maybe you might discuss with your medical doctor, you might have to increase your inhaler during that time. But when it's less than 50% of your 100% predicted, then you're in trouble, you need to go to the hospital.
Gotcha.
And that's what it allows you to do.
Yes.
It measures in the medium and the larger breathing pipes.
Yes.
So you're able to tell in patients that have moderate or severe asthma, but you wouldn't be able to pick it up in the mild asthmatics.
Got you.
Yeah.
Listen, we have loads of fun, and we encourage you not to look at it as a chore.
Yeah.
Take your kids, make it a fun time of the day where you can sit together and actually do the exercise. I have loads of fun trying to let my kids hold their breath and blow out as hard as they can, and almost make it competitive for them. And every night it's like, come on, I'm going to get a better score than last night, which makes it really fun for the kids at the end of the day. Doctor, thank you so much for your time, your invaluable time, and for your incredible knowledge on this subject, which we know there's a lot of stigma that surrounds it, and through these kind of discussions, hoping not only to break down those boundaries and those walls, but also make the conversation one that we can have with our kids on a daily, ongoing basis, and our kids' friends and our friends, so they can learn more about asthma.
Thank you for having me. It's been a pleasure.
Thanks so much for watching today's episode. Pop your questions in the comments section below. Also, remember to visit bronkiboosters.com to view all the videos, learn more about asthma, play the game, or download the comic book.